Wonderful. Welcome. My name is Tracy Pepe, and I am we run a business, but we also do a lot of research. And today we're focusing on the research. We're focusing on a presentation we gave to Queen's Park, and we're talking about a white paper that we completed. And if you're interested, I will send you a PDF file of the white paper. It's quite extensive. It's 50 pages long, but it really summarizes the work that has been going on. And this is so not aromatherapy. And I always like to start with this because the misunderstanding in this world is that sometimes certain smells do certain things, and a lot of that is folk medicine. However, the research, what we focus on is the interaction between how scent impacts the brain, and that is why it's called olfactive science. So we are looking at three goals with this mission, especially in Ontario with Queen's Park, is we want to standardize the intake process. Or give suggestions to create an intake process that is more organic and holistic and includes sensory. That is the key. The second part is early prevention or education to families to give people the opportunity to start to understand these simple tools can impact. And thirdly, we are trying to show another form of sensory stimulation, specifically within care, what it would look like. So let me, down here. So this is the team. Jolin and Tamanna are research students that we hired to create an in-depth report. One had a political science background that positioned this for policy, and the other one had a medical background or has a medical background to position this from research. There's some anecdotal research in here, but there's a lot of not. And so we wanted to make sure that we were presenting the information because a lot of people aren't aware that within the last 40 years, the industry specifically has been doing a lot of work. And when I mean the industry, I mean olfaction, fragrance, perfumery, smells, raw materials, chemistry. They have been looking into how scent impacts the brain. Some of it is for consumer research, for selling obviously products and so forth, but there's a huge percentage of that research that's coming out, which is specifically for mental health. And so I wanted to bring light to this information because there's a lot of it that is just going under the radar. So what we're really talking about is called anosmia, which is the loss or the absence of the sense of smell. And it is estimated that 78.4% of seniors in Ontario in long-term care homes have experienced little to no sense of smell, and this impacts their taste. People who lose their sense of smell first, often this happens, and it can, if it's connected to Alzheimer's and dementia, 5 to 7 years before the diagnosis. If we can bridge the gap and have the conversation with the family members where mom has lost her sense of taste, then we're not going to fluff that off as aging. We're going to actually say, well, maybe we should go see a doctor. Because these little things happen, and it is always, we're just getting older. And the interesting thing about your sense of smell, it is the last thing to go. In fact, it sharpens as you get older if you utilize it. And it is one of the few senses, like hearing, that is connected to the limbic system. So it is really, really, really a connection point for emotional-based wellness. So the question always became, what if the families knew earlier? What if we could prepare and not react for this issue of dementia or Alzheimer's or Parkinson's? We could actually get better treatment, and we could get preventative care, and we could provide real choices. As we know right now, the diagnoses are usually coming much later, and then families are scrambling, and then often they're in a position where they have no support, and then it kind of goes out of, we go down the next level. So the idea is a preventative mindset, but to do that, we have to get the awareness out. We have to start getting the education out to the public, but also within the long-term care homes. So what we are noticing and what we've seen in quite a bit of the research is anywhere from 28.9 to 53% of the residents in long-term care are malnutrition or at risk. And 1 in 3 residents, the depression is the most common conditions in long-term care. There's a higher reliance on medication. 50% of long-term staff show signs of burnout, and on average, dementia Parkinson's diagnosis takes 5 to 7 years. What's really fascinating is no one is asking the question, can you smell? Because I guarantee you, if you can't smell, you can't taste. These two are definitely correlated, and we know this is a missing link in the intake process because there is no conversation that is happening regarding this. So sometimes people in long-term care are not particularly eating because they're not interested in eating. They can't taste the food, and there's no real engagement. The kitchen is often quite far away. It is not like a home setting where someone is cooking and it's dinner time. And so these things are really, really interesting because they do compound something as simple as I don't feel like eating. The depression is one of the most common ailments that we work with when we're doing work because we see the depression show up in many, many different ways. The reliance on medication, we have done an internal work and we're showing a 30% reduction on depression medications just by working with sensory, smell, engaging this. This actually helps not to increase medication, but actually to work with different tools. And if we start to offer the question, would we like to try something alternative first versus going to medication, the families are much more supportive of that. Plus, it's also very costly. The long-term staff, we have seen the burnout rate because sometimes there's not a satisfaction with the engagement with some of these individuals. And what we find is when you're working with smell, it's quite fascinating because it's immediate, but it also transfers over to the caregiver, and the caregiver can work and smell, and it's a pleasant thing, and it's not a task that is difficult. And so we are seeing definitely an impact from the program because the people who are implementing it love it because it's something new that they can use, they can get creative, they can add it to the care plan. And so this helps with the burnout, not necessarily changing it because of the work hours, but it at least gives a little more of a tool that associates with the staff. And then the Parkinson's, as we talked about, the early diagnosis is the educational point. So the students did quite an in-depth research report and survey over 3 different types of people. The first were healthcare workers. The second part were CART members, so they targeted healthy seniors. And then the third were the general public, but often the people who were taking care of them, of family members in long-term care. And from the survey, they found 85% had a strong support for modernizing long-term care assessments. They felt that the assessment itself was pretty bleak or very paper-oriented, but not very person-oriented. The awareness gap regarding early indication, 57% of the entire survey didn't know about the connection with loss of smell. And I found that very interesting because we had almost a 50% ratio of healthcare workers on the survey. 85% felt there was a potential for improved care, and 85% felt early detection could improve the quality of care. So what does this look like? Now, this is tricky because sometimes you can see the video and sometimes you can't. And if you can't, I will send you the YouTube link. So let me see if we can do this. Let me know if you can hear.
Hi, I'm Sandy Crowley, and I am the Director of Programs and Rehabilitation for Kandera Living. which means that I oversee and work with 12 of our communities throughout Ontario. So one of the things that we've really leveraged in our butterfly community is utilizing scent for residents who have late stage dementia. With the different scents that we have, rosemary, and also the one that you helped make, the pomelo, those have been introduced as, I want to say therapies almost, non-pharmaceutical therapies. So we will, for 15 minutes, maybe have a diffuser going in which, rosemary will be in the room to help get someone more alert, increase of appetite, then they'll want to have more intake of food. The other piece is the pomelo, which we utilize to help residents to sleep better who have dementia. So utilizing it, I was going to say for expressions, or as most people will say, behaviors, but also as an intervention that can be non-pharmaceutical. The spa scent that we have reduces that anxiety going into the spa room to take a bath. Oh, such a great connection to your memory. I think it brings out a lot of memories. So if they smell, I want to say rosemary, they may think about their gardens. If they smell lemon, they start to think about, lemonade. It's a direct link, memory and scent and being able to smell. I think there's several reasons why it's valuable. One is that we do need to tap into that, all our senses. They're there for a reason. And so having that connection between memory and scent, huge for what we want to leverage with some of our residents. But also it's a means to communicate. So bringing out that communication and the storytelling that's linked to, oh, this smells like my grandmother's perfume, or this smells like wet dog, those sorts of things. We also see it as the non-pharmaceutical interventions, which help because honestly, when we have the pomelo going, people sleep longer and they have a better quality of sleep, which means that in the morning, if you're well rested, your cognition is better, your risk for falls is lower. There's many contributing factors that help with a good night's sleep. And we all know regulation of emotions as well, which is huge in sleep. The last piece is having that integration of scent into our program. So that is a cue for what type of program we will be doing. So Tracy, you've been wonderful we will send you our activity calendars and you will send back what scent may be paired with it to help increase the benefits within that program. And so that's been immensely helpful. So we may have in the room Mandarin going for an exercise program. We have our fresh blue in the spa to make it more of a spa experience and calming for people. So we pair the scent with the program, which has been very outstanding.
You just take it and you kind of shake it underneath your nose. Yeah, right on the you think that is? You know what it is? Ooh. Does that remind you of it? You want to smell it again? Does that remind you of it? Yeah, there's in the video. Is it good? Does that remind you of? Does it remind me? Tamanna?
There we go. Really smelling it.
Yeah.
That's really
Does
good.
it remind you of anything?
My dog in the back room
Your dog? It smells like your dog?
there. Yeah, dog is there.
Okay, there's another one. So this is a different one, and I want to know if you know what this one is.
So I was.
That's okay. That's okay.
That's different,
Yeah.
Okay.
Word for caramel. What's the
Outside?
Outside.
I said outside.
Great.
Grandpa loves it.
That's great.
That's good.
Does it bring up any memories?
Walnut.
Well,
Like the plants.
That's good.
Butter smells outside.
Okay.
I'm very curious. She must have like any, no, any of the sense. Does that smell like the ocean? The pretty one? But does it smell like the ocean? You're at the ocean once? What ocean? Do you remember? Did you? Okay, did you go swimming? No, it was too cold. No, water was cold. Yeah. What else do you remember? Was it a nice sky, a good sky? Was it waves? Were there waves? Yeah. Windy. Yeah. Do you remember like seagulls? You know, the birds? Is this strong? Is this one? You think it's strong? Yeah. Okay. We'll keep it a little further apart.
Yeah.
Yeah. Do you like this one?
That's true.
Okay. Not necessarily simple as the. Yeah. Thank you for participating. Yeah, really, really appreciate it. It's nice. Nice to meet you. Thank you.
This last resident, she's very vocal and she screams quite a lot, which is obviously disturbing to the floor. But what was really interesting is that her nurse noticed a huge shift when we started to use some of the smells.
Carol, try to smell this. How is that? Carol, do you like it? Here. Yeah. Let's see. Which one is that? What is it, Carol? Can you smell it? Yeah. We can just have. Here, Carol. Hold it. You can have that.
So 3 things from the video. Even though Sandy uses diffusers, it's not the way we teach. We teach with the one-on-one because it provides the person full control of how much they want to smell. We work with naturals, but we work with concentrates, and so you only need a drop, which reduces the cost of the program too immensely. And so that one-on-one engagement is also really helpful because what happens is family members can do it as well. It becomes storytelling. But we know that there are certain smells specifically that have direct impact on the brain. And so when Sandy was talking about pomelo, we know that melatonin is released when there's high levels of a raw material called limonene. And limonene is found specifically in citrus oils. And citrus oils are not commonly used for sleep in someone like you and I, where the research shows lavender. But with people who are on neurodiversion, their brains respond to it much differently. And so we determined the success of this basically from the feedback from the program. And then it was kind of tested with the research that we knew that scent and was increased with melatonin. So that is why Sandy was specifically talking about that. So there's 3 practical changes that we're focused on right now in the province of Ontario. We're trying to standardize an intake process. My sister is in long-term care, and when we went for her intake, it was actually quite horrific, to be totally honest with you, from a family member, but also from her perspective. My sister is schizophrenic bipolar, and she responds to senses, specifically smell, taste, and music. And there was no questions regarding any of that. And that was really interesting that they're going to make a treatment program for my sister, and yet they don't know what kind of music she likes, or if she likes certain smells, or what foods or tastes that she's attracted to. And I thought that was really bizarre, because the sensory component is the wellness aspect, and that is the person-based care model. So that kind of was the shift in my mind on where we needed to make the first shift. The second one was education and awareness. We have a scaling system where we have basically a kit that has 4 different smells that triggers 4 different types of the brain, and it gives you a number that you can work with, and that number can change. It can go up or it can go down, which is fascinating, because when you smell more, it increases your sense of smell. But we know with a lot of staff members who've had COVID, they also have lost their sense of smell, and some has gotten better, but some has not. And so this staff training really engages them, but it also engages them to talk to the family members, which then kind of pulls that full circle around. And then the early detection, ideally having this conversation more. I have this vision, and I don't know how I'll do it, but I'm working on trying to create the peanut allergy sticker, where you see a peanut allergy sticker, you know that that product has no peanuts and you can buy it safely for your children. I would really like to have some type of sticker that talks about remember to smell your coffee, or remember to smell your breakfast or your lunch, or smell the roses, really smell the roses. Because if we are not smelling, we are not engaging a part of the brain, which is fascinating, because that part of the brain is primal and it is connected to the limbic system. And one of the things we noticed during COVID, and when I reference we, I mean my industry, is we know when you lose your sense of smell, you have an impact of about 70% of increased depression. And so by increasing your sense of smell or utilizing scent, it actually helps with depression. And that is something that I know with my sister, because she uses scent quite frequently for her bipolar. And it helps to, when she's feeling anxious, she can do something for herself and not rely on a PSW or get a drug, or she can be a little more self-sufficient. And this is something that she can incorporate within her room or within her treatment plan. So by not asking any of these questions from the beginning became the red flag for me. And so that's where this white paper and sitting down at Queen's Park kind of became the focus. So right now, our focus came back from Sandy and her team at Kindred Living. They really wanted me to focus on 3 areas: their meal time, their bathing time, and the sleep time. Those are 3 areas in particular within their butterfly unit that they really experience the most amount of issues and trouble. So we did that. And so we targeted the scents that we know will help with the bathe. We called it spa. And it is actually designed for luxurious spas to create that atmosphere that you're in the water and it's calming and it's relaxing. The mealtime are gourmand smells, and these are not naturals, but they are formulated in a way where they smell like waffle. And by smelling scents that smell like food, it actually increases your appetite because it turns on your brain to turn on the stomach juices to say it's time to eat. You know, it's hard just to look at someone and say it's dinner time when there's no sensory engagement to that, even seeing the food being prepped. Sleep was one of Sandy's major concerns because she has seen the most falls happen. And so for her to have her teams feel that they're getting more restful, they get much better response the following day. So by reducing 1 to 2 hours a week in behavioral related care, she's noticing $100 to $280 savings. So, which is interesting because this was a preliminary project we did over a year. And these were the types of dollars that they're seeing by just using different elements of sensory to help with the individuals. So where do we go next? Well, we had a meeting with Algoma University because I'm working with their social working program, and the Toronto Metropolitan University, we're working with their TMU campus in Brampton. The goal is to get ahead of this and to start integrating the education into the programs. I always find it interesting with doctors that they have 15 hours of diet as training, and yet every disease is related to what you eat. So I just find this fascinating that we need to kind of get ahead of it. So I've had a conversation with both of them. They're in the process of looking at curriculum. And as a business owner, I always find it difficult when students are coming out of the schools and they're not up to date with what industry is doing. And industry is on top of this, and industries move forward. So that is one area we started to work with. We're trying to collaborate, do more evidence-based, but more forward thinking, because this is a long-term project that I'm working with. And so this is how we're focused with the educational piece. The second part is in October. It was August. It's been delayed now. This is the first new home that has changed the intake process. They have revamped their questions. They have 5 sensory questions that they focus on in certain areas. They do a smell test. They talk about hearing. They talk about taste. They talk about touch. They talk about all the 5 senses, and they have changed this, put it in the WOBI, I think it's called. It's a program that is already integrated into long-term care, and there's a series of questions. And Sandy's basically, they have inputted this. Now, this is with responsive care group, but moving forward, every single person who comes into the new home will be questioned about sensory. So then from there, they can actually start to create really specific care plans. Because the other problem is the long-term care minister has increased your hours of 4 hours a day, but not giving you any tools to accomplish that. What we know with when we incorporate scent into a program like exercise, it's longer because the patient or the resident is engaged more. So it becomes more of a quality. So you're not doing more programming. You're just taking the current programming and you're enhancing it. So the whole part 2 where we are at is if we don't start asking about the sensory experience, we'll continue to misinterpret behavior. And this is a big part of the problem. And I'll just stop sharing, but a big part to what we do is a lot of individuals are nonverbal. A lot of individuals don't have that opportunity to communicate and are basically not going to participate in bingo or some of the classic recreation programs, and so they do nothing except maybe watch TV in certain areas. Some homes are not like that. I see a huge difference, and this is a part of me that is frustrating as a family member who has a loved one in long-term care. Each of your homes are very different. Each of your organizations are different. You have 5-star hotels and you have 1-star hotels. And I can tell from the engagement of the types of programming. So this is the direction. I will, do you have any questions? Specifically, Courtney, do you have any questions? Let me see.
I love the fact that that the intake is going to be including sensory information, because I am in activities, and so we do a lot of things that would be great with sense to include the scent in it. So that would be, yeah, I like that idea.
So this is something we are working. Ministry is trying to make some changes, and they were looking at music therapy, scent therapy, a variety of different. So they're in the process of making some ministry changes. In the meantime, the industry is shifting.
Good.
And so what I can do is I can send you the white paper. It's quite extensive. And
Oh, that'd be great. I would love to read it.
yeah, I am. And if you have any more specific questions, each month we put out a pretty extensive newsletter, and in the newsletter is all the research that's coming out, best case practices. I teach a webinar, a web-based programming, so to educate your teams. We have a kit that we provide. It's basically 4 modules. It takes about 6 months for those who want to incorporate that, like music therapy. However, for those who have, or like you're saying, doing different things, setting this up at the beginning to evaluate the resident to get a number, meaning 10 out of 20 is fair. 5 out of 20 means they have a very poor sense of smell. Knowing that, then that is something you can gauge with the family. And if that is improving, it will have an impact on the emotional well-being of the individual.
Yeah, for sure.
So I appreciate what I will do is at the end, I will send you a YouTube link for this video if you want to share it with staff, and I'll send you the white paper. If you have any questions at all, please let me know. I'm more than willing. I am heading into New York because we are presenting this hopefully in the United States, because we're trying to make this shift. And some homes have scent-free policies. We address that right off the bat, and we educate people how to create a scent policy that is actually works with occupational health, because you can't enforce the general scent-free policies because they just don't work. So,
and we have that here, and I've been a few times I've used scent just a little bit, definitely not to your standards, but, and I've been told we have a scent-free policy around here. Well, in a controlled environment, I think scent is possible. So we just have to work. We have to work and find out exactly how we can incorporate it. But yes, absolutely.
Yeah, I have a video we've done on it. I'll send you that link as well. And but
Thank
we are
you.
in the Region Appeal uses our program, and they have the strictest scent-free policy, and we're in the hospital. We work with the hospital. So I understand scent-free, and I know what the policy kind of looks like when it comes to fine fragrances and perfumes. But it was just something that was put together versus the science. And so if you're going to enforce something, we give you the what to enforce, because there is actually some specific information. I found it on the flip side very interesting that I have gone into homes who use diffusers and throw any oil because they love it, not realizing that people who are on neurodiversion have a completely different reaction than someone who, like you and myself. And then a lot of times they just think it smells pretty and it's more of an air freshener, but they're actually agitating their residents because it is something that they can't control. So even though it's natural, it's not necessarily the best approach either. So I'll send you a whole bunch of information, and if you have any questions, it would be my pleasure to answer them. And I really appreciate your time today, Courtney.
Oh, well, thank you for doing that. Thank you for presenting. That was lovely.
Well, I hope we have a mission. We're trying to change this. It's personal for me with Linda, but if I can help other people with this process, it's my goal. So
Great.
lots of passion behind it.
Oh,
But
excellent.
thanks again, and we'll be in touch.
Okay, thank you so much, and good luck in your presentation in
Thank
New
you.
York.
Thank you so much.
Okay, bye-bye.
Bye bye.